With breaking news and political commentary from a public servant, serial entrepreneur, community leader, philanthropist, and American patriot, and a darn nice guy, it's time for the GrassRoots TruthCast and your host, Gene Valentino.
Hi, everybody. Welcome to another edition of Gene Valentino's GrassRoots TruthCasts. As you know, we do these grassroots interviews throughout the year with varying guests from varying walks of life. It's our chance to bring forward what we think is something inspiring, innovative, truthful, something that gives you some insight on something hopefully you haven't seen before. Our guest this week is Dr. Dave Harvitz. He's a DPT, a doctor of physical therapy. He comes from a source of clinical research and development in the way he approaches physical therapy. You know, many times we think of the physical therapist, we go to these camps or places in your town. Well, I'm going to go see a physical therapist because the doctor sent me there to go see this physical therapist. And it turns out to be a person with training, but sometimes the lack of insight or depth in his ability to apply science and acuity to a specific problem. And that's what distinguishes my guest from the pack today. In fact, he stands out amongst the select few in physical therapy that really does a deep dive on physical therapy and a remedy or a cure that might obviate your need to having to go for surgery. And that's what he has been trying to do. Doctor, welcome to our show today.
Absolutely. Thanks for having me.
This is interesting. You know, we met you through a mutual friend, and in the process of getting to know you, I didn't know physical therapy from proctologist.
Oh boy,
so that's a heck of a thing to say. I apologize. But the truth is, he's done a great job at helping me and my wife, and I thought it's time for you guys to get an understanding of what we got here. He's originally from Philadelphia, but he and his family found their way here to the Panhandle of Florida. And David, I'm really glad you're spending a little time with us today. Dr. Dave has a website, www.renew. It's the www.renewpensacolap.com. And I'm sure you can speak more to that. Yep. So why does someone need a physical therapist like you to help them with their problem?
Well, I think it's a really great question because a lot of times people don't actually know what physical therapists do, just like you don't know the difference between us and a proctologist, which is a crappy place to be. And so really, honestly, the physical therapists work in a wide variety of settings. So we work in acute settings after surgery. We work in settings with nursing homes. A lot of people know we kind of help older folks walk around. But then the area that I'm, mostly working in now is what we'd consider orthopedics. And so musculoskeletal problems, and the best way to describe that, most of the time I tell people, pain with movement. So if you have pain with movement, a physical therapist is a really great place to start for your problems, okay? And so that is the main thing. A lot of our training is in what we'd consider biomechanics, kinesiology. A lot of anatomy and physiology is going to be built into that to get to the point where we can actually assess what is causing your pain and then at the same time correct it appropriately.
Where do you think we can talk about the business plan. I think your company started in the early days when we first had the privilege of meeting you. But where did you go from there? How has this concept grown? Why is it becoming more popular?
Well, I think the concept that you're referring to is the self-pay or the cash-based model. And honestly, the reason why I went that route is because insurance is broken. I don't think anyone is surprised when I say that, but the medical system is broken in a lot of different ways. And so it's just worsened by larger corporations making decisions that do not have clinical expertise for patients and for doctors. And so when you have me, for example, working with you and your insurance is paying for my care for you, I don't work for you. You're not the one paying the bill, right? Mm-hmm. I'm working for the insurance company. That makes sense. The person who's paying is the one that I'm going to cater towards. And that's just a natural thing of business in general.
But medical insurance has gotten so expensive, David, and the insurance costs related to that have gotten crazy. Mm-hmm. And so much has changed. Some of these special concierge programs have come out. And I for one, wonder if all this extra money that most people cannot afford, how are they able to afford, how are they able to justify your service, whether it's included on insurance or not?
Well, I think what people want is solutions and outcomes. I
Correct.
mean, so if you want something, if you want that the 5-day vacation in Disney World, then you'll save for it. And it's the same thing is true. Not everyone's willing to invest in their health. And I think the people who are not interested in that probably aren't my clients. It's the same thing is true for the concierge physicians that are coming out. There's a lot of doctors that are leaving the Medicare and the insurance world, just like myself, and going direct to the consumer and saying, hey, look, you've got access to me. Why don't you call me whenever you need me? And there's some kind of monthly plan for that.
But doesn't a doctor prescribed or doctor requested MRI really get to the bottom of the problem?
Well, that you bring up a separate issue. So you've got the whole insurance problem, and a lot of times, in order to get even to get an MRI, doctors will order physical therapy just to check the box for the insurance company. But when we get to the point where we're looking at MRIs and X-rays and imaging studies, you also need to consider, well, how accurate are they? There is a number of studies that show that they're not very accurate at diagnosing the problem with low back problems, for example. So, give you an example. If you have lower back pain, there is a 67% chance that you have a herniated disc or some kind of degenerative change. If you do not have back pain, you have a 67% chance of having a herniated disc or degenerative changes.
So it doesn't always evidence itself.
No, it doesn't. And so you can take a picture of the back and find something or not find something, but that has a zero correlation to whether or not you actually have lower back pain.
We're talking with Dr. David Harvitz, a doctor of physical therapy. His company is called Renew, and it's here in the Pensacola region of the Panhandle. It's a concierge physical therapy service that I'd encourage you to take a look at. Dave, you want to give us your website?
Yeah, so our website is www.renewpensacola.pt, as in physical therapy.com, and you can go ahead and check us out and go from there.
Let's talk more about the ailments and the remedies in a minute, but let's start at the moment with how you got started, what's your business model, and where are you going in the future?
Yeah, so it's actually a quite interesting story how I got started. At the end of 2019, Medicare came out with a lot of cuts. That is a regular thing in the medical world. Think about your industry and think, okay, every year I'm going to get a letter from the people that pay me, and they're going to tell me they're cutting rates by 3%, 5%, 10%. And every year, physical therapy in general across the country gets these rate cuts. Inflation goes up, income comes down. And so what you have is you have multiple scenarios in every industry, whether it's the home health industry, orthopedics, outpatient hospital, whatever it is, we're getting these cuts. So at the end of 2019, we got a really massive cut for the home health industry. My company turned around and said, we're going to cut your salary by 40%. And I said that wasn't not going to be good for me. And so I ended up starting Renew. I took my first patient mid-February of 2020. My website went live maybe a week or two after that. And my company called me in and fired me on March 9th and said, we're not going to deal with this. And so they saw it as a conflict of interest. I didn't. And at the end, and then obviously a week later in March of 2020, everything shut down for COVID. Right. So best time to ever start a business is in the middle of a pandemic. But that didn't necessarily affect me too much. It was actually quite, I think, neutral for me. Thank God for Governor DeSantis. I mean, he navigated it very well. We shut down for a short period of time. We came back, masks, no masks. It was all really well done. And so I don't feel like COVID either hurt me or helped me. It's kind of a neutral thing. And so month over month, I doubled in revenue to the point where I maxed out. And I've been hiring since. In fact, if you were to say, hey, Dave, what has been the biggest hindrance to your growth? It absolutely has been the inability to hire the right people for this kind of job.
Interesting. It's a situation now where we're not going to talk politics today, but we certainly do see such a change going on with how things were handled in Florida. And I can't believe it, but I have seen so many so many different enhancements in Florida, distinguishing itself from the rest of the nation. But we're not talking politics, but DeSantis really did
Yeah.
help out guys like you that were trying to get businesses off the ground. Everyone running around with masks on and vaccinations that they were mandated to take, but not as much in Florida. And the people you were working on, was there a lot of COVID-related symptoms?
That's actually quite interesting. I've seen a very large uptick in younger people with heart problems, right? I know, and not necessarily my practice, but my own personal life. I know several people who perfectly healthy got the vaccine and then had some repercussions after that. In my practice now, I am seeing a lot of people who are experiencing a lot of global inflammation because of what I would consider an increased viral load. Now, in this case, what I would say is it's probably more of biomarkers that are entrapped in the body. I mean,
that were there before COVID?
no, probably not. I mean, you'd also. I mean, it's hard to say. I mean, a lot of people. It's not everyone. A lot of people do carry around chronic viruses. Like that's something that every functional medicine doctor out there is going to tell you is there. The question is it going to be symptomatic? And it seems as though, stack upon stack upon stack, a lot of people feel. I feel like a lot of people have definitely kind of hit that tipping point with COVID, whether it's the spike protein or the vaccine or the actual COVID itself.
Symptomatic. What's weight loss have to do with the level of your business?
Okay, so let's steer differently. So I think a lot of people assume that if I'm overweight, therefore I have pain.
Yeah.
That's not necessarily true. There's lots of people who are overweight that do not have pain. What I do find is that there's usually dysfunction that has a lower threshold for pain that is reached sooner when people are overweight, right? So, for example, you may have someone at a weight of, let's say, 300 pounds, a little overweight for their height, and then what you do is you reduce their weight and they feel better. Well, the dysfunction didn't go away. They still have the pelvis issue or they still have the hip issue. But then if you were to keep them at 300 pounds, they don't lose weight, you can still fix the dysfunction and then they can go about the merry way without actually having to lose weight.
When a patient is seen by you,
yeah.
what is their expectation and what is your experience in the likelihood of a cure?
So it always depends. That's the go-to answer for medical professionals. It depends. But the expectation for my clients, so my client, let me define what that is. So earlier I said pain with movement, but let's be more specific for me. My perfect client is someone who's had pain for 20, 30 years and has failed at a traditional PT, chiropractic, medical management of their pain. It's just not working.
Why?
Why is that
why have they failed?
They fail because the medical system is not designed for people with chronic pain.
So are you saying, are they just providing a patch on the tire with painkillers? Is that what you're saying?
Yeah, I mean, if you were to say, hey, Dave, create a system that promotes chronic pain, I would create our medical system. It pretty much starts with the poor identification of the root cause of pain, right? And then symptomatic management and not elimination. And then also, by the way, let's use MRIs to improperly diagnose, and then let's use pain medications to reduce symptoms.
Wow, that's a pretty strong statement. We're with Dr. Dave Harvitz, Doctor of Physical Therapy. His company is called Renew. Go to www.renewpensacolapt.com. You can contact him through his website and ask for more information from him and maybe get an assessment of your situation with him by phone. Dave, you want to talk a little bit more about, tell you what, let's take a break. And when we come back, we'll follow up with a few more thoughts. We'll be back right after this message.
Gene Valentino's GrassRoots podcast. He tells the truth. He tries to get information out there to make sure people make good informed decisions.
Welcome back to another portion of our GrassRoots TruthCast interview with Dr. Dave Harvitz, a doctor of physical therapy. And doctor, we left off talking about the condition of the medical industry and how physical therapy relates.
Yeah, and so we were talking about designing the worst case scenario for a chronic pain epidemic, and that's kind of what we're in. And so the question is so, all right, we're in a situation where a lot of people are in chronic pain. It is by far one of the largest expenses in the healthcare industry is the management of chronic pain. In fact, if you have severe chronic pain, it ends up tripling your medical out-of-pocket expenses on a yearly basis. And so, we talk about people who, can't afford it. They can't afford not to be honest. And so when designing a solution, we actually have to do a couple things. First of all, we need to find the right medical professionals to team up with. Physical therapists are not the only answer. The second thing we need to do is we need to be willing to admit that the medical model that we're dealing with now is broken. So less emphasis on imaging studies to diagnose. And one thing I didn't get to mention is MRIs and x-rays are really great at ruling things out. So yes, please go get them. Make sure you don't have the tumor. Make sure you don't have the fracture, right? But then after that, don't use the MRI to say that's what's wrong, because that's not going to actually help you. What will help you is a movement assessment to determine what the tissue is that's causing the pain. And then so the next step is finding someone who actually has the time. And so one of the reasons that physical therapy doesn't work for a vast majority of people is because they have one physical therapist for 3 clients all at the same time going in a circle doing exercises. That's not physical therapy in my opinion. That is exercise supervised by a physical therapist, which is better than nothing. And a lot of times 80% of people will get 80% better. But the problem is you've got this vast majority of people that won't respond very well to just exercise, that need those dysfunctions corrected. And that's when you have to enter in somebody, and it doesn't necessarily have to be a physical therapist. I'm willing to say, functional medicine doctor, medical doctor, chiropractors, there's a lot of people that are in the solution space that can take care of the dysfunctional tissue, but you can't fix the root cause without identifying it first.
So would you call this a science of movement?
Yeah, and so the term that we're describing is kinesiology, the study of movement, right? The science of movement, but then you can apply it to biomechanics. So when you say it hurts when I extend backwards, or it hurts when I lean forward, or it hurts when I do this or that, in my head, and most people that are trained like me are going to say, oh, this tissue, this tissue, this tissue are stressed in this way. And then you put all that information together and you synthesize, this is the techniques I probably need to do based on history, based on who you are and whatnot. And then you carry out the treatment. And that's what separates me maybe from a lot of other physical therapists.
Is what? Is
the test retest model. A lot of people were taught in school to use a lot of what we call special tests. Those special tests are supposed to test those structures. The problem is they're not very accurate. However, if I assess you and I say, well, the highest probability is this number thing here, I'm going to fix that. And then I fix it, and then half of your pain goes away. Guess what? That's a really good test to tell me that that's probably part of the source of your pain and a part of the solution.
What about blood work and things that are picked up in the blood that would not be related to movement?
Mm-hmm. That's a really great question. That's what physicians are for. Remember, I was saying there has to be a team around people that need to be monitoring this stuff. There's a lot of things in the blood, and it's not just blood tests, but urine tests. There's a lot of different biomarkers, even just allergy tests that are going to be really important to pick up on certain things, and that's where you need to be teaming up with other professionals.
Again, folks, we're talking with Dr. Dave Harvitz. Dr. Dave Harvitz is a doctor of physical therapy here in Pensacola, Florida, but his territory is the world. And I say that tongue in cheek, but it's not so remote. When you started, you were local here in the Florida area. Tell me about your business model and how you're expanding.
Yeah, so our business model is definitely very different. The first thing is what differentiates us is that we are a cash-based model, so you will have to pay out of pocket for our services. But at the same time, when I'm working for you, your outcomes are going to get better. Okay. In fact, a lot of times, if you're thinking out of network, you're thinking it's going to cost more, but that's not always true. A lot of times, we actually save money for a number of reasons. The second thing that's different about us is that we are mobile. We do have some offices in the area, but at the same time, coming to you actually reduces your risk of falling off.
Really?
Right, we call that drop-off rates,
Mm-hmm.
right? So if I'm coming to you, you're going to be like, well, he's coming. I better be ready for him. And so we actually get better outcomes because of it. I started here in Pensacola. We expanded to Destin. grew that business out. So now we've got 2 thriving locations, and just this past month we expanded to Baltimore, Maryland.
Really?
Mm-hmm.
And a future plan for further expansion, I presume?
Absolutely. And so one of the things that I want to do is, the question that I've always struggled with is, okay, if I want to actually take my style of treatment and I want to replace myself, not just with me and not just with physical therapists, but a system, I need to come up with a way to scale the unscalable. A lot of times you think franchising, you think of whittling down the parts of a business to the lowest common denominator. What's the least skilled person I can insert into a system, and then let the system be the driver of profit, right? Well, the problem with that, with a franchise maybe for physical therapy, is that the franchise requires a doctor.
Mm-hmm.
Right? And so what we've done is we've implemented a residency program attached to a franchise. I think this is a completely novel idea. No one else is doing this. There are physical therapy franchises, but there are numbers driven and usually controlled by insurance.
And it's requiring an insurance standard, not a quality of care
Correct.
issue, which I think is very important to understand. We sometimes don't find a solution. We patch the pain.
Mm-hmm.
And that doesn't mean you've gotten to a solution. That means you've just masked the solution.
That's right.
From a true cure. That's what I learned about with you. And quality versus quantity, right? I mean, so if you're growing slower, but qualitatively, you can make sure that the way and method you're growing with your other doctors is in fact the standard you intend in this growth plan you're intending. That's pretty interesting to find out that this is growing this way. We're with Dr. Dave Harvitz, doctor of physical therapy. He's here in the Panhandle, and he's been very good for us personally. And you also came across a few interesting things that I find interesting, and that's arthritis. Arthritis is how do you cure arthritis? Because that's obviously identified with pain.
Yeah. So when you talk about arthritis, you have to really consider what it is, and all arthritis is the wearing away of some of the cartilage in your joints. Okay, your cartilage. People think that cartilage is just part of the bone. That's not true. It's its own entity. It's got its own cell structure. It's its own physiology. And one of the things that arthritis is defined by is the spacing between your bones. Well, the space between your bones is taken up by the cartilage. So cartilage has a couple things that it does. Is it increases the congruency of a joint. So if a joint is a little bit off kilter, all right, the congruency is going to go down and actually can be worn away just by that. So a lot of times arthritis can be caused by joints above and below it. So for example, a lot of people have knee pain with arthritis, but really what's going on is there's maybe a hip or a foot problem causing it. And then you talk about arthritis being a cartilage problem. It wears away, but you don't necessarily have pain when it wears away. There's usually secondary and tertiary problems that are associated with that. So not unless you truly have bone on bone. A lot of times your arthritis is asymptomatic, causing secondary and tertiary problems above and below the knee, for example.
And how do you identify it? How do you address it
Yeah, so one thing you have to realize is that the cartilage in your knee is actually responsible for producing lubrication. And so if it wears away, it's not going to be as good about producing that lubrication. And so there's very specific things that we can do to actually produce that lubrication artificially, and then set you up in a position where you would be producing that lubrication on your own.
Switching topics, it's interesting. David has been recently debuted on a private podcast. Well, it's not a podcast. It's a video production that's being assembled now. Hopefully it'll go nationwide on Netflix or the likes. It's a series called The Blocks, I think you mentioned, right?
That's right.
And the Blocks had featured David on episode number 5, and I think more recently on episode 10. And so you want to explain The Blocks?
Yeah, so it's not episode, it's a whole series, season 5 and season 10.
Oh, season 5 and season 10.
So in season 5 so let's talk about The Blocks. The Blocks is the largest entrepreneurial TV reality show in the country. Okay. Now, it's of course not large enough to maybe be on Netflix just yet. But what they do is they take 10,000 applicants a year. or a season, they put you in pods and set you up for different tasks throughout the week of the shoot to compete against about 60 to 70 people that are chosen for the show. So I was fortunate enough to be chosen to be, brought in. And then season 5, I competed for 5 days in a series of pitches, different exercises that do with entrepreneurial endeavors. So, for example, they'll teach us about social media and kind of how to use it. That's an easy thing to consider. And then what happens is they say, okay, develop a social media plan, and then we move forward from there. Okay.
So, are they calling you back to continue with the season?
Yeah, so in season 5, after we shot it, it released back in January, and then they did invite me back for season 10, which is what we just shot about 2 weeks ago.
Wonderful. Well, we have a superstar in our hands pretty soon. Let's hope Netflix or the likes grabs it and gets you on. It's a testimony of just how well you've been doing with this innovative science that you've taken on. Very uniquely, Dr. Dave Harvitz has taken on a science of what I'd call his own version of clinical care for you. We're joined today with Dr. Dave Harvitz, and this concludes probably another one of our GrassRoots TruthCast episodes. Thank you for joining us here today. This has been a great episode. And if you'd like to know more about David, his science of clinical care in physical therapy, you're welcome to reach him at www.renewpensacolapt.com, and he'll be able to connect back to you through his website. And share it if you want with your other friends or family, anyone in need of a mechanical cure for the structure of our bodies, getting relubed for normal, active, safe mobility in our daily lives. Thank you again, Doctor. Gene Valentino here with another episode of the GrassRoots TruthCast. Thank you for joining us. See you again soon.
Thanks for joining us for Gene Valentino's GrassRoots TruthCast. Be sure to like and subscribe, and God bless America.